Did you know that forgetting simple things like why you walked into a room might signal something far more serious than just aging? Have you ever wondered, could I or someone I love be at risk for dementia? And what can I do to protect brain health? The good news is that there are things we can do to safeguard our brains. But first, it's crucial to understand the early signs and risks of dementia. In this video, we will dive deep into the early warning signs of dementia that many people overlook and explore the classic symptoms that help doctors diagnose the condition. We'll also discuss actionable steps you can take to protect your brain, along with exciting new treatments that are bringing hope to millions of families worldwide. What is dementia? Dementia is not just one disease. It's a term used to describe a variety of symptoms that affect memory, thinking, reasoning, and even behavior. Imagine your brain's neurons, the tiny messengers of the brain, trying to communicate, but their connections are damaged or cut off. Dementia is a serious communication breakdown within the brain. It affects not just memory, but also daily tasks, the ability to recognize loved ones, and even the ability to communicate. Most people believe that dementia is an inevitable part of aging, but that's a misconception. While it's true that our brains do slow down with age, dementia is far beyond ordinary forgetfulness. It's about struggling to complete daily tasks, losing the ability to recognize loved ones, and having difficulty following simple conversations. 9 early signs of dementia that few people know. Recognizing the early signs of dementia can make a huge difference in terms of early diagnosis and treatment. Early intervention can help slow down the progression and provide better support for the person affected. Let's take a look at some subtle but important early signs. Struggling with words. We all forget a word here and there, but with dementia, this becomes more frequent and severe. For example, a person might say, "Pass me that thing on the table," instead of naming the object they want. This is because they struggle to find the right words, a phenomenon called aphasia. The difficulty in finding the right words or using vague phrases is often one of the first signs of cognitive decline, affecting both communication and social interactions. Changes in senses. Dementia can affect senses in unexpected ways. Someone might start struggling to recognize faces or objects, making it hard to identify loved ones or everyday items. They may also lose their sense of smell or taste, which can lead to them no longer enjoying foods they once loved. In some cases, these sensory changes can even cause a person to have trouble judging distances, which could lead to accidents or confusion in familiar settings. Losing interest in hobbies. Did your book-loving friends suddenly stop reading? Has your chess partner lost interest in games? Apathy, or the loss of interest in things that once brought joy, is a common sign in early dementia. The person may seem unmotivated, emotionally flat, or withdrawn from activities they used to engage in. This symptom can often be mistaken for depression, but it is important to pay attention to any other cognitive changes happening alongside it. Muscle weakness and coordination problems. Difficulty with fine motor skills, like buttoning a shirt or typing, or more frequent falls may occur in types of dementia like Lewy body dementia or vascular dementia. These early motor changes are often overlooked, but they are crucial signs of cognitive decline. For example, someone may struggle to maintain balance, leading to unsteady walking or falls. This is particularly common in Lewy body dementia, which affects movement and motor control. Postural and walking changes. If someone begins to shuffle their feet, takes small, hesitant steps, or starts to hunch over while walking, it could be an early sign of dementia. These physical changes are often linked to movement disorders associated with dementia, such as in Lewy body dementia. A person might appear to have difficulty with posture, moving more slowly or less steadily, which can affect their ability to perform daily activities. Increased forgetfulness of everyday activities. Forgetting routine tasks, such as how to make a cup of coffee or what to do next in a familiar activity, can be a sign of early dementia. While everyone forgets things occasionally, these memory lapses may become more frequent and affect a person's ability to live independently. Someone may forget their daily routines, such as personal hygiene or paying bills, and might even get lost in their own neighborhood. Difficulty following conversations. Another early sign is a noticeable struggle to follow or participate in conversations. A person with dementia might forget the context of a conversation or lose track of what was said. This may manifest as them repeating questions or having trouble finding the right words. They may also seem to zone out or appear confused when trying to understand what others are saying. Mood swings and personality changes. Individuals with dementia may experience significant mood swings or personality shifts. For example, they might become easily agitated, anxious, or depressed for no apparent reason. These changes can sometimes be accompanied by outbursts of anger or frustration, which are often misunderstood as behavioral problems rather than signs of cognitive decline. Personality changes can also include a shift from a previously friendly and outgoing demeanor to becoming more withdrawn or suspicious. Difficulty with decision-making. Dementia can impair judgment and decision-making abilities. A person might make poor decisions that are out of character, such as wearing inappropriate clothing for the weather or falling for scams. Simple tasks, like deciding what to eat or where to go, may become overwhelming. Over time, this may escalate to difficulty managing finances or organizing everyday activities. 13 classic symptoms of dementia. As dementia progresses, the symptoms become more noticeable and disruptive. Here are 13 classic symptoms of dementia that you should be aware of. Avoiding social interaction. Fear of embarrassment or confusion leads to withdrawal from family and friends. Social isolation worsens cognitive decline. Incontinence. Difficulty recognizing the need to use the bathroom is common in the later stages. This symptom can lead to accidents and is often overlooked as a simple aging issue. Hallucinations. People with dementia may experience vivid hallucinations, seeing or hearing things that aren't there. This is especially common in types like Lewy body dementia. Trouble solving problems. Even simple tasks, like cooking dinner or paying bills, may become difficult. People with dementia often struggle to plan and make decisions. Short-term memory loss. Forgetting recent conversations or events is a hallmark of dementia. Long-term memory may remain intact for a while, but short-term memory is affected. Losing things in strange places. Misplacing keys in the fridge or shoes in the oven is a frequent issue for people with dementia. This symptom often frustrates family members and caregivers, but it's a common sign of memory deterioration. Mood swings. Sudden emotional shifts, from calm to irritated or unusually sad, are common in dementia. These mood swings are often unpredictable and may be confusing for the person experiencing them and their loved ones. Getting disoriented. Forgetting where they are, what day it is, or who is with them. This confusion disrupts daily routines and can lead to distress. Struggling in conversations. Difficulty following conversations, forgetting words, and losing track of what's being said can make communication challenging. Poor decision-making. Wearing inappropriate clothes for the weather, like a winter coat in summer, or falling for scams are signs of impaired judgment, which becomes increasingly common as dementia progresses. Inappropriate behavior. Dementia may cause a person to act impulsively or say things that are out of character. These behaviors can be distressing, both for the person and their family. Repeating questions. Asking the same question multiple times is a common symptom because the brain fails to retain new information. Confusion about time. Someone with dementia may forget what day it is, or even believe that it's a different time of day. Time becomes fluid and hard to grasp. How to protect your brain health. While there's no cure for dementia yet, there are things you can do to protect your brain health and reduce your risk of cognitive decline. Here are a few tips to help keep your brain sharp. Keep learning. Try new things to challenge your brain. Learn a new language, pick up an instrument, or engage in puzzles. Manage stress. Chronic stress can shrink the brain's memory-related areas. Relaxation techniques like yoga or mindfulness can help. Control diabetes. High blood sugar damages blood vessels in the brain. Maintaining healthy levels through diet, exercise, and medication can help prevent this. Watch your weight. Obesity in midlife can increase the risk of dementia later on. Steady weight loss can help reduce that risk. Quit smoking. Smoking reduces blood flow to the brain. If you quit, your brain's recovery starts immediately, even in your 60s or 70s. Exercise regularly. Just 30 minutes of walking each day can boost blood flow to the brain and help protect your brain cells. Stay socially active. Interacting with others through clubs, volunteering, or just calling a friend can help keep cognitive decline at bay. Eat for brain health. The Mediterranean diet, rich in fish, fruits, and vegetables has been shown to reduce the risk of dementia. Sleep well. Sleep is when your brain clears toxins. Establishing a relaxing bedtime routine can improve your quality of rest. Understanding the signs of dementia and taking proactive steps to protect your brain health is key to reducing the risk of cognitive decline. Early detection, along with healthy lifestyle changes, can make a significant difference in managing dementia's progression. Although there's no cure yet, science is making great strides in improving treatment options. Remember, it's never too early to start caring for your brain. So, stay curious, stay active, and don't ignore the signs of dementia. Together, we can create a healthier future for our minds and our families. If you found this information useful, don't forget to subscribe, like, and share this video with someone you care about. Stay informed and take the steps to protect your brain health today.